Assalamualaikum dear student. Today I am going to talk about the clinical feature of pituitary tumors. So in the previous video I have talked about pituitary tumors. The most important and the most common type is the electrotrapedenoma. The other is somatotrapedenoma and the mammosomatrotrapedenoma. The fourth type is the cartiotrapedenoma, and the fifth type is thyrotrapedenoma, and the sixth type is gonadotrapedenoma. So the electrotrapedenoma will produce prolactin, and the major effect of the prolactin are the one is the amenorrhea, the other is galacturia. It is a milk production hormone. So there will be galacturia and loss of libido. So the amenorrhea, galacturia, and loss of libido are associated with the electrotrapedenoma. The other is somatotrapedenoma. The somatotrapedenoma, first one, somatotrapedenoma will produce the growth hormone, and this growth hormone will produce mainly two type of effects. If the somatotrapedenoma are present from the birth, it will cause the gigantism in children, and if it is arise during adulthood, it will cause the acromegaly in the adults. So the third type of tumor is the mammosomatotrophy, in which both the prolactin and growth hormone level rises in the blood. So it will produce both the clinical feature due to prolactin and the clinical feature due to growth hormone. The clinical feature due to prolactin are amenorrhea, galacturia, loss of libido. In the growth hormone will produce if it is if the mammosomatotrophy is present in the child, it will produce gigantism, while if it is arise later in adulthood, it will produce the acromegaly. So the fourth type of tumor is cardiac tumor. The cardiac tumor produces the ACTH, and the ACTH will goes through the blood into the adrenal gland, where it will act on the adrenal gland, and it will produce the cortisol. So hypersecretion of the cortisol will cause the Cushing syndrome. So if we reject the adrenal cardiac, then there will be no cortisol in the blood, and due to stimulatory effect of the ACTH, the cardiac can develop again after rejection of the adrenal gland for the cardiac. So this condition is called Nelson syndrome. The development of the adenoma after their rejection due to ACTH stimulatory effect is called the Nielsen syndrome. The other is the thyrotrapedenoma. The thyrotrapedenoma will produce the TSH, and the TSH will goes through the blood into the thyroid gland, and it will stimulate the thyroid over secretion of T4 and T3, and it is one of the rare cause of the hyperthyroidism. So when there is hyperthyroidism, there will be clinical feature due to two effects. One is due to sympathetic activity, and the other is due to metabolic activity, hypermetabolic activity. So the gonadotroph adenoma, this is very rare, and due to gonadotroph adenoma, there are two hormones produced. One is the FSH, and the other is LH. And the other non-functional pituitary, there are about 25 to 30% of the pituitary tumor. And the main clinical effect produced by these tumor are due to mass effect. The main clinical effect produced due to mass effect. So if the adenoma is non-functional effect and it is gradually growing, it can suppress the anterior pituitary. It can suppress the, for example, here is adenoma. For example, here is somatotrapedenoma. If it is gradually increasing in growth, it will suppress the other cells in the. It will suppress the other cells in the anterior pituitary and can cause the hypopituitarism. So this was all about the clinical feature of the pituitary tumor. For more videos, subscribe, like, and share. So thanks for watching the video.